Well, you certainly all look well, and I hope you're all staying safe. So very basically, can I ask you please to mute your microphone until you wish to speak, and when you do wish to speak, if you put it back on, unmute the microphone. If I miss you by not seeing your hand on here, you just raise your hand, I'm sure I'll see it in the end. Okay? Right, thanks very much then. So what we'll start straight away is item 1, apologies for absence, and at the minute I've got Councillor Mullen. Are there any more, Angela?
No, that's it, Chair.
Right, and the next one is minutes of the last meeting, which was held on the 8th of September. We've all had an opportunity to look at them. To agree the minutes on item 2 from the 8th of September.
Agreed.
All agreed?
Agreed.
Right.
Agreed.
Any matters arising on it? Any issues? No? Right, we'll move on to item 3, and we have John Costello, briefing in relation to mental health provision at the QE. So, John, you may have a number of colleagues you may wish to introduce.
Hi, thank you, Chair. Yes, I see we have on the call today as well, sticking through it, we have Joanna Clark, who has just joined the QE. Welcome, Joanna. So she's a new appointment, and she's going to be, correct me if I'm wrong, Joanna, but looking after health services for the Trust in Gateshead. So she's attending today, as I say, it's one of our first meetings in her new role. So basically, Chair, I mean, this is, and colleagues, this is a really a very good news story for Gateshead, Gateshead patients. So we wanted just to bring that to the attention of OC members and to make members aware of it. And in summary, the QE basically has been successful in securing NHS monies, capital monies, to modernise the older persons inpatient wards at Sunnyside on the QE estate. And that will mean that going forward, each client will have their own single room with ensuite facilities, and that's really, really important to meet the standards of Department of Health and CQC. So that's it in a nutshell, but let's give it more on a background to that, because the Trust have had to work very, very hard and very, very quickly to deliver on this. And as you know, the Sunnyside ward is based within the trauma unit at the QE. We know for a number of years now that the ward hasn't been, I suppose, regarded as fit for purpose in terms of the new standards that NHS has for inpatient care. I mean, when it was built, obviously it was, but time has moved on, and naturally there's a drive now to get rid of dormitory-style accommodation, mixed accommodation, and where patients don't have ensuite. So because of that, that would have, that's been a risk. The Trust would see that as being a risk, if you like, for them, and it clearly would have impacted on their ratings from CQC when they've come around to inspect the mental health services at the site. So just only in July this year, it was an opportunity to bid nationally for NHS monies, capital monies, and the Trust took that opportunity. over the last 6 or 8 months or so to get the application in, which has now been approved. And they've been working, a steering group has been set up to actually deliver on the project. And as part of this, in terms of where would it locate the place, space became available next to the Crackside unit, which is also on the QE site, and is very, very close to the existing facility. And the new unit will provide 10 single-room beds with ensuite, and crucially will meet the Department of Health and CQC regulations that I mentioned going forward. So I mentioned that the steering group being set up, which has involved staff from different disciplines, and there's been a significant amount of engagement as well with patients, carers, users, and other organisations as well in actually putting this together. And also there's planned to have further engagement events with those same groups to get ideas on decor, colours, artwork and so on. So basically that the users of the facility have had a big input in shaping its design and so on going forward. So groundworks have commenced because they've had to, because they basically have to spend the money by March 2021. So if you think about it, from July to March, that's a very, very quick turnaround. And they're the things that had to get over the line, and they've managed to do that. So hopefully at the end of it, the QE will have, and Gateshead patients will have a very modern facility for them to use when they need it. Of course, we also know that, the drive nationally and locally and regionally is to try and support more people in the community. And that's always going to be the way. But clearly there'll always be a need to provide some inpatient care for the people with mental health issues. And this facility will provide the QE the basis to do that going forward. Thank you, Chair.
Thanks very much, John. I know the committee one or two of the committee who have been working long and hard on this may have something to say, but we're very, very grateful, basically, to the QE, our officers, and the staff of Gateshead Council for the hard work they've put in to bring this to Gateshead, which is going to be a tremendous benefit for the residents in our area. So I'll open it up to questions, please, or comments. Michael.
Thank you, Chair. Absolutely delighted with the news. Just for clarification there, John, did you say it was for older people? Yes? Well, can you just put a bit of meat on the bones and explain what older means? I know I'm getting old now. What sort of age group is it limited to?
Well, I think it's more about the kind of, my understanding is the mental health issues that people might have. So it's related to a person who's older, basically. So it's mental health linked to age. So basically, if you think about it, if you kind of group them up, you have the CAMS services, for children and young people, right? And then you have adult mental health services, which is being covered by the United Side Indicator, the Living Together consultation that was done some number of years ago by the Cumbria and Northumberland and Tanawea Mental Health Trust. And they provide adult inpatient facilities. And, there's big proposals, they got big money to refurbish facilities in Newcastle, which will provide a basis location for Gateshead patients. And then at the end, you have then a specific provision for older people with mental health problems, and that has been provided previously on the Sunnyside site. So it's part of the wards, if like part of the services and facilities provided at the trust. And this is basically to say, well, now we've got more, better, fit for purpose ward facilities to treat them when we need to treat them there.
Can I come back again, Chair?
Of course, John. Michael, Mr. Mayor, sorry.
Just make it clear in my head. So this isn't having an impact on the plans for St Nicholas's?
No.
It hasn't altered the plans at all?
No.
It's going to add, so this is actually a win-win situation?
Absolutely.
Yeah.
Absolutely. So you had say a number of beds. Obviously the numbers using that has reduced. The number of beds in the existing Sunnyside ward, which is not fit for purpose, and now all it means is that the QE has a new place to use for those same patients. It does not impact on the plans the Cumbria and Northumberland Tanawea Trust have for inpatient facilities for the adult population generally. No.
That's great. Can I just say, Chair, it's looking a lot more like Christmas. Thank you very much.
I haven't got my Christmas tie on, Michael. I forgot that one today because I could have played you the tunes. Steph.
Thank you, Joe. Yes, I was just going to add a little bit to what John has said and just to echo that this is really positive news for Gateshead. And to come back on Councillor Hood's query, yes, generally, you're talking about older people often with organic mental illness, so things like dementia, but also people who might suffer from what we would class as functional mental illness. So sometimes we try not to think too much about somebody's age, but more about the type of support that they need. But no, as John has said, really positive for Gateshead.
Yeah, couldn't have been better. Any further comments? Marilyn?
Thank you, Chair. I just wanted to ask, at what stage do you get classed as an older person? Is it 60? And will there be some sort of maybe crossover between, if somebody's got a particular need, there might be an older person, but would they end up going to the facility over at St Nick's, which is being developed?
I think possibly, I know Lynn's on the call and you might be able to explain the pathways, Lynn, in terms of how that's decided. But as I say, Councillor Charlton, one of the things we've tried to do over the years is focus less on age of the person and more on their specific needs. So if somebody needs, a dementia service, even if they're a younger person, then making sure that they're cared for in the right environment. But as I say, I know Lynn is the service line manager for the mental health services up at the QE, so she might be able to give a little bit more clarity on the care pathways.
Hello, nice to meet you all. Steph, you did a very good job there in kind of describing that. So absolutely, so you would kind of say 65 is when somebody would technically become an older person. However, it's very much about the need of that person, kind of thinking about the NHS longer term plan, thinking about somebody's functional needs and just finding the right place that meets their needs. But as a basis, it's around about the age of 65 when you become an older person. But it would be very much, needs-led and kind of the best environment for them.
Thank you.
I'm wondering, obviously the time isn't right yet, but we've visited most places through the QE, different wards. When the time's right, do you think we could possibly have a visit up here? That's the full committee. Well, invite the full committee. Is that possible?
Absolutely. That's, we would have invited you already, but obviously because of COVID, that's the reason why. So we're hopeful that kind of once spring comes and, hopefully the vaccine's been rolled out, we can have you up before the opening so you can have a good look around the ward.
That'll be fantastic. Thanks. Any further questions or comments? Well, again, I'll say it. Fantastic the way that this committee, the council and the QA have worked to bring this to Gateshead. And it hasn't been easy and it has been an awful long time, but thanks very, very much to everyone. So can I move on to item 4, please? And that's COVID-19 update, and that's Gerald Tompkins and Steph Downey.
Sorry, Stuart, before you move on,
Go on, John.
Somebody has their microphone on and it's picking up a lot of background noise. I can hear it sounds like television in the background. Can I just ask people to make sure that they're muted, please? Because all I could hear on that previous conversation was background noise.
Right, thanks very much, Jonathan. So has anybody found it yet? Let's see if you hear it again. Let me know, Jonathan, please. It's a shame for anybody to drown me up. I really feel sorry. Right, so item 4, COVID-19, Gerald and Steph. Gerald, you haven't got your microphone on.
I was going to say, Gerald's starting.
I thought I must have. I think I unmuted myself, then didn't come straight in because of Councillor Wallace's question, and then muted myself when I started. So apologies for that.
So is the telly turned down now?
Can you hear me all right?
Yes, fine.
Right, well, I just need to line myself up, so I've got the presentation up, so excuse me a second. Let's have a look. Right, can you see the presentation now?
Yes.
Right, let me get to the first slide. Okay, so yes, it's myself and Steph who are going to take you through this. I will cede the floor to colleagues from the QE at 1 or 2 points in case they do want to chip in, but we'll play that a little bit by ear. So I'm going to take you through some of the data and where we're up to right now in terms of the numbers of people who have had COVID and so on. I'm going to talk a little bit about the tier system and where we're at with that, as well as the mass testing and vaccination programs. And then I'll hand over to Steph to say more about the sort of management of some of the key frontline services and the impact of COVID on all of those. Okay, so let's move straight on. And we can circulate these slides afterwards, by the way. So, right. I think that is a slide that some of you should be familiar with, which shows the total number of cases that we've had on a day-by-day basis since the pandemic began back in March. There's a load of background noise starting again, Councillor. The reason for the difference in scale here is largely about the numbers who are being tested. So although it looks like we have had more cases in this second wave, in fact, we just don't know how many cases were here because we didn't test very many people. The only people basically getting tested were the ones going through hospital at this stage. So each of these vertical lines is the number of cases on a given day. The orange line is the 7-day rolling average number of cases per day. Okay, and it drops off right at the end because you need to get two. You need to have 3 days either side. The average is calculated on the 3 days either side of any given day. So you can see that since about the 5th of November, when we peaked, we have seen a steady and consistent fall in the number of cases that we're experiencing Gateshead. And currently, we've got a rate of about 115 people testing, who are positive with COVID per 100,000 residents. And we'll come back to that and compare that with other parts of the North East in a few slides' time. If we look at the fall in more detail over the last few weeks, you can see the 7-day, the rolling average peaked around here, which is what, 5th, 6th, that's the 6th of November. And as you can see, the average has gone down consistently. We've had 1 or 2 days when we've had more cases than the average, but by and large, consistent fall day by day in the number of cases. And you can see in the last week that's gone down even further. So that in the last, we put these slides together at the end of last week, but just to update you a little bit, on the 7 days to the 6th of December, there were 167 cases in Gateshead. And just by way of comparison, when we went into the local restrictions at the end of September, we'd had 225 cases in the previous 7 days. So we are below the level we were at the end of September when we went into the second iteration of lockdown, which I think is a really, really positive place to be. I think we'll see this. I think we'll continue to see the numbers decline for now. Any easing of the restrictions, of course, is likely to reverse that trend. And that's the constant balancing act that government and so on are having to make on a week-by-week, day-by-day almost, or review-by-review basis. And we'll come back to that when we talk about the tiers. So if we look at how we compare with our neighbouring authorities, this is for all the 12 North East authorities, and you can see that in terms of the rate per 100,000 people, we are the second lowest. When we pulled this together on the 2nd of December, there have been times when we've been lowest, there have been times when we've been at this end of that chart. But you can see at the moment there is some clear water between us and some other parts of the North East. But we're not that different to the neighbours over the road in Newcastle, or down the road in Durham, or in Sunderland. And for some reason, Redcar down at the bottom end of the patch is quite different from its neighbours in Teesside at the moment. This dotted grey line here shows you where we were at a week ago. So you can see the reduction in the rate in the past week, which has come down quite substantially in Gateshead, and as it has in virtually every other area in the North East, it's come down everywhere to a greater or lesser extent. The blue numbers here are the actual number of cases in the previous week to when we drew this up. Okay, So, as I say, that was 214 on the 2nd. It's now 167 in the last 7 days. So, positive news in terms of the right direction. I think we're also seeing positive story in the QE in terms of the number of patients in the hospital who are COVID positive. I think this is quite an interesting way of looking at the cases the QE have had as inpatients throughout the pandemic. So the red line shows the numbers during the first wave of the pandemic. So that goes from day one for the red line.